Hey, Miss Smith, how are you doing? I see you got your tray dropped off here for lunch. Or do you think you're ready to eat?
Yes.
Okay, how are you feeling?
Not bad.
Not bad, eh? Do you think you're going to need a little bit of help today to set up?
I think so.
You think so, eh? Okay, how are you feeling right now?
I have some pain.
A little?
I'm weak.
Okay, you're feeling weak and you have some pain.
Yes.
Okay, so if your patient has pain, what you would do is you would offer some pain medications beforehand to make sure that they were comfortable throughout this procedure. You want your patient to be as comfortable and as alert as possible during a feed or during a meal. So I would have ensured that Ms. Smith received some pain medication if it was ordered about 30 minutes prior. Now you're saying you're feeling pretty weak. Do you think you're going to need a lot of help with your feeding today?
Let's give it a try.
We'll give it a try. Okay, so what we'll do is we'll play it by ear. Are you okay if I bring the head of your bed up, all the way up, just to decrease your risk for choking? Okay,
Yes.
perfect. I'm just bringing your head up. And before we get you fully set up for your meal, do you need to use the washroom at all?
No.
No, okay. So it's really important to offer your patient and adhere to their elimination needs prior to any skill or procedure. Okay, so that's out of my way. Miss Smith, I'm just going to place this apron on you. Is that okay?
Yes.
Okay, I just want to keep your linens nice and clean. You want to make sure that you refer to this as an apron and not a bib. We try to avoid using terminology that is associated with newborns and infants and children when we're working with an older adult. So Miss Smith, what I'm going to do is I'm just going to bring your bed up to a comfortable working height for me. So I'm going to stay in and help you a little bit. So I think your bed brace are off. So I'm just going to go ahead and fix that before I do anything else. There we are. So patient safety is also a priority. I'll try bringing the bed up again. Now before coming in to see my patient, it's really important that we review a few things within the patient's plan of care. So one of the first things that you want to be mindful of is the patient's diet. There are many different types of diets that exist and can be assigned to your patient or ordered for your patient. Your patient can be ordered what's called NPO, which is nothing by mouth. Your patient can be ordered clear fluids, which obviously means they're only allowed to have fluids that are clear, much like a juice or water or a tea. Patient can also have full fluids. So at that point, we're thinking of things that are a little bit more thicker in terms of consistency. So things like a pudding or jello. Patient can be ordered a regular diet, and sometimes you'll hear that referred to as diet as tolerated or DAT, so as the patient tolerates. The other types of diets that exist are considered therapeutic diets, and they are going to be prescribed to patients who might have something going on systemically, and depending on what that might be, they might need a specific or a special type of diet ordered. For example, someone who has a cardiac history might be ordered what we call a low sodium diet, or someone who has diabetes would be ordered a diabetic diet. So these are things that I'm reviewing my patient's plan of care before coming in to assist with the feed. And then once we receive the patient's meal tray, we're making sure that what is on the tray matches up with what was ordered. And then filling in any gaps and holding off until we clarify to make sure that it is in fact the appropriate diet. It's very important within your assessment piece, if you haven't done it already, and you should have done it before coming into the patient's room, is assessing your patient's ability to swallow, but you can also review that in their plan of care. Swallowing assessments are typically done by, pardon me, your speech therapist. They'll come in and work with a variety of different types of food to see how the patient handles the different consistencies, and then can place them on specific swallowing restrictions. If your patient is a swallowing risk, what you should have at the head of the bed on the wall is a poster or an indicator that lets us know that that patient is at a choking risk. So that's very important to review in the plan of care as well. If your patient has some concerns in terms of their motor skills, then you might want to consider letting occupational therapy know as well, because they can come in and assess the patient and assess how those motor skills affect the patient's ability to go about with their activities of daily living. And as you guys know, one of the activities of daily living is the ability to feed ourselves. So they would be included in the patient's plan of care as well. Once you come in the room and you can set your eyes on the patient and their environment, this is where you, as the the nurse or the healthcare professional, you want to assess the patient's oral cavity. Okay, so I'm noting that my patient's dentures are in right now, but what I'd consider is if they were not cleaned after the previous meal, I would remove those dentures and clean them in the sink for the patient, which I'm actually going to show you at the end of this video once this patient is done eating. It's also really important to assess your patient's level of consciousness. So are they alert and oriented to person, place, or time? That's going to be important to assess because it will tell you how your patient's going to be able to participate in this skill. It's also really important to consider limiting any distractions in the room. If your patient especially is someone with dementia or Alzheimer's, these are all things that you want to consider when setting up for your feed. Having an understanding of your patient's senses and any limitations that they might have is also important. So if your patient wears glasses, you want to make sure that you put them on the patient. If your patient has hearing aids, you want to make sure that they're in place as well, so that the patient is able to participate as best as they possibly can. Now, your patient may have glasses, and even with the glasses, their visual acuity is going to be significantly decreased, so you might have to explain your steps in much greater detail for these types of patients, especially if your patient is going to be able to eat independently. Your role in that case will be to let them know where each food item is on their tray, and we'll talk about that shortly. So from here, the other thing you want to consider is the positioning of your patient. So Miss Smith here, aside from having some discomfort and some weakness, she's able to sit up fully in the bed, okay? What I would do, because this bed does not fully sit up, is I'm going to lean Miss Smith forward, so pardon me, and I'm just going to adjust the pillow to make sure she's sitting up at a little bit of a higher angle, just like that. Again, to decrease the risk for aspiration. If your patient, let's say, was what we call a total feed, meaning they require full assistance from the healthcare professional, what I would do is I would turn Miss Smith onto her side. I'm going to lower the head of the bed to be a little bit lower. And then as the patient is on their side, we need to make sure that their chin is tucked into their chest. And the reason for that is to close off the airway as best as we can, allowing the GI tract to open up. And again, that only further decreases the risk for aspiration. Again, we don't want any food to fall into the respiratory system or into the lung, because then the patient can end up with what we call aspiration pneumonia. So once I've positioned my patient, I've done my assessment, now it's time to consider implementing the next following steps. So now we're in that planning phase. So I have here the tray that was dropped off by the kitchen staff or dietary staff, and I'm going to make sure that it is within my patient's line of vision. Okay. So it looks like we have some pork chops, some mashed potatoes, and a salad, Miss Smith, and a cake there for dessert. I'm also noting that we have some cranberry juice here and some hot water with a tea bag if you'd like a tea. Would you like me to start by maybe putting the tea bag in your cup of water?
Yes, please.
Okay. Again, I've washed my hands when I came in, but now that I'm starting to feed my patient, I'm going to wash my hands one more time. And you don't necessarily have to wear gloves here, but I'm going to don a pair of clean gloves. And then there's a few things that I want to point out on the tray in terms of my equipment. So the first thing I'm going to do is I'm noting that we have a special cup here on Miss Elliott's tray. And so you'll see here that there are 2 handles on the side. So in the event that your patient is weak, then they might be able to use a cup like this where we have 2 handles, making it much easier for your patient to use. Also note that we have a spout on this cup. And so if your patient is unable to fully tilt a cup into their mouth, this spout here facilitates that for them. Keep in mind that if you're working with hot fluids like tea or coffee, that you need to remind your patient to allow it to cool off before they go ahead and take any sips from that. You want to avoid using a spouted lid or straws with hot fluids so that your patient doesn't burn the inside of their mouth as well as their lips. So Miss Smith, I'm just going to put that tea bag in for you. Okay. I have some sweetener here. Do you take sweetener in your tea?
No, just black.
Just black. Okay, so we won't use the sweetener today. I'm going to put that lid back on. We're going to let that cool down and we'll reassess in a little bit. So I'm noting here that we have some special utensils on this tray for Mrs. Smith. She does have some generalized weakness and her fine motor skills aren't as great as they once used to be. And so it looks like occupational therapy has come in and has provided us with some special tools to help Miss Smith eat. So we have here a butter knife and a spoon. But what's special about these 2 utensils is you'll notice that we have a widened grip on the handle of these utensils. You can't see this, but these grips are also weighted, and that allows the patient to get a better grasp on the utensil. And because of the weight, it also allows them to hold it much easier than if it wasn't weighted. Again, if the fine motor skills were affected, these are great tools for your patient. Just to kind of add on to that, sometimes what happens is you might get a regular utensil, much like this spoon here, but you have the weighted and the widened grip. And all I have to do is just put that spoon into that weighted grip, and that makes it easier for the patient to eat with. Some of the utensils that we have also have a curve in them, so instead of the patient having to bring the utensil to their mouth, all they have to do is bring it up this way, and because there'd be a curve in it, they're able to eat much easier. There's so many different pieces of equipment out there, so these are just a few examples. When you are setting up your tray, if your patient's a full feed, meaning they're going to require total assistance, then you need to consider still talking them through the procedure and still letting them know what's on their tray, much like I've done already for Ms. Smith. But if your patient, let's say, only requires setup, maybe because their fine motor skills aren't the greatest, we need to open a package of sweetener, or maybe we need to remove the lid off of a pudding. These are all things that we can do before leaving the patient's room. So you can have someone who's independent while they're eating, you can have someone who is a minimal assist, you can have someone who requires some assistance in terms of setting up the tray, especially if the patient has some issues with their visual acuity. In other words, maybe they're blind. Or if they're a total assist, then at that point you're staying in the room for the entire procedure. So a few other things that we want to consider is you want to get your patient to be as independent as possible during this procedure. Okay? So if your patient, let's say, is able to even just wipe their mouth in between bites, that's fine. You're still promoting independence as best as you possibly can. If this is the first time, let's say I'm coming into the bedside with Miss Smith, and there's nowhere really in the plan of care that captures how she eats, then what I'm going to do is I'm going to assume that she's independent, and I'm going to assess where she meets those barriers. Okay, so based on the fact that she has some discomfort today and is feeling weak, I'm comfortable setting up her tray for her. I'm going to ask her to take a few bites and start while I maybe hang out in the patient's room. And then what I'm doing is I'm watching how well she does independently. Then that allows me, as the healthcare professional, to gauge how much assistance she's really going to need. Really what it comes down to is you're assessing the patient's risk for aspiration. We really do not want them to choke. So if you feel like their risk is high, then you must stay in the room and assist them for the entire procedure. If your patient is relatively independent and just needs the setup, then what you can do is make sure they have everything within reach, including their call bell, lowering the bed, making sure the side rails are up, and then you can go on and see your other patients and then return in about 15 to 20 minutes, checking in on your patient to see how they're doing. But again, we're going to assume that Miss Smith today is a total feed. So what we're going to do is I'm going to get as close to my patient as possible. I've washed my hands. I've donned clean gloves. We've provided oral hygiene to the patient. She didn't need to use the washroom, so we're good to start. So if your patient had some issues with visual acuity, it's important to explain to them what's in front of them. And the way we do that is by considering that what is on the table is the face of a clock. So in doing that, I'm going to let Miss Smith know that in front of her she has a round plate divided in 3 sections. Okay, you want to break up your directions very carefully. Don't upfront everything all at once. You're going to information overload your patient. But in terms of the plate, Miss Smith, at 12 o'clock, if we were to imagine this to be a clock, you have your pork chop. Okay.
Okay.
Perfect. At about 5 o'clock, I have a salad here for you. And at 7 o'clock, looks like we have some mashed potatoes with a little bit of butter. Okay, are you okay with this meal today?
Yes.
Perfect. Okay, and how's your appetite? Are you getting hungry?
A little.
Okay, perfect. The other thing I want to point out is we have your tea, which we already have made for you at about 11 o'clock. I have cranberry juice for you at 9 o'clock. And then at 1 o'clock, we have your dessert, which looks to be a piece of vanilla cake. Okay? Now, I'm just going to ask you, seeing as you need full assistance today, what would you like to start with?
Some tea would be good.
You'd like to start with some tea. Now, would you be okay? I just made this tea, and so the water's still hot. Would you be okay with holding off for a few more minutes as that cools?
Sure.
And you know what? To facilitate that, what I'm going to do is I'm going to remove the lid to let that cool off a little bit better, and then once that's ready, I'll let you know.
Okay.
How about maybe a sip of your cranberry juice?
Sure.
Okay, so let's get that ready for you. So I'm bringing your cranberry juice to your lips, and I'm just going to pour a little bit in. I'll have you take a sip there. Perfect. Okay. Doing okay?
Yes.
Okay. Would you like another sip before we move to your food?
No, I'm okay.
Okay. So what you're seeing is I'm facilitating the patient making their own decisions. Again, because the patient is a total feed here, what I am allowing for is her to make the decisions as to what she'd like to eat, right? So I want you guys to imagine if you were a patient who was a total feed, imagine what it might be like if you were being fed by someone else. Okay, it can be very challenging. This is a great opportunity to work on your therapeutic relationship with your patient. You want to take your time, you want to converse with the patient to make sure that they're comfortable throughout the procedure. So with the pork chop, mashed potatoes, and the salad, Miss Smith, what would you like to start with next?
Some salad.
Some salad, okay. So what I'm going to do is I'm just going to put a piece of lettuce. Okay. I'm going to come in, I'm going to feed the patient. Okay. You want to make sure that you're not overloading your utensils with food and shoveling it into the patient's mouth, coming back and shoveling without giving them the time to appropriately chew and swallow. Okay. One thing you need to consider is some of your patients that you might end up working with tend to have the ability, or not the ability, but tend to pocket their food. So what I mean by that is let's say maybe your patient has had a stroke and they're weak on their right side. What happens is if we're not positioning that patient appropriately, the food can pool on the affected side or pocket on the affected side. So your patient might chew and chew and chew, but instead of being able to swallow, the food falls into their buccal fold or in the inside of their cheek. So as you are feeding your patient, this is why it's important to converse with them, because as they talk back to you, you're able to do your oral cavity checks, making sure that you're not overloading them with food. You still feeling okay, Miss Smith?
Yes.
Okay. Would you like a bite of your mashed potatoes?
Sure.
Okay. So I'm just going to grab enough on my spoon, and I'm going to go in and I'm going to feed the patient and allow them to take a bite. Let's say I got a little bit of food on Mrs. Smith's face or her chin. What you want to avoid doing is actually taking your utensil and scraping it off their skin and then feeding it to them, okay? Rather, what I would do is I would take the apron that's here and we're just gonna wipe that away, or we might use a napkin or a Kleenex that's at the bedside, okay? So never scrape food particles off the face back into the patient's mouth. What would you like a bite of next?
Some pork chop.
Some pork chop. Okay, so what I'm going to do is I'm just going to cut this up in tiny little pieces for you. Okay. Okay, and then I just have a small piece of pork chop here for you. There you go. Okay. Also take note that some patients don't like their foods touching each other, so you need to take that into consideration as well. Let's say that the meal is done, okay? What I might do is I might leave Mrs. Smith with her tea. I'm going to leave your tea on your bedside table for you to work on this afternoon.
Okay, thank you.
And before I get rid of the tray, I need to assess how much my patient has eaten, okay? And typically the way we assess that is by percentage. So did the patient eat 100% of their meal, 75% of their meal, 50% of their meal, or 25% of their meal? And that's important for you to take note of because we need to document this within the patient's plan of care, especially if we're documenting the patient's intake with their output to make sure that there's a balance there. Okay. I'm noting that you have a little bit of cranberry juice left. Would you like this left behind as well?
Sure.
Okay, so I'm going to leave that on your bedside table, and I'm going to check in frequently to help you work with that, okay?
Okay.
Okay. Do you have any questions before I pull your tray away?
No.
Okay. What I'm going to do, Miss Smith, is I'm going to remove the tray. I'm just going to bring this outside. I'm going to be right back, and we're going to get your dentures all cleaned up for you for the afternoon, okay?
Okay.
All right, so give me 1 sec. I'll be right back. So I'm just going to lower the patient's bed. Because we just finished a meal, I'm going to leave the head of the bed up for about 30 minutes. You do not want to lay your patient flat. Again, you are going to increase their risk for aspiration or choking, but you're also increasing their risk for reflux. So Miss Smith, are you okay if I leave your head up for a little bit and I'll come back?
Yes, that's fine.
Perfect. So I'm just going to remove my gloves. I'll wash my hands. And make sure that her overbed table is within reach. Make sure her tea and her juice is within reach. Making sure that her call bell is in place. That's great. So there's your call bell there on your right hand side. I'm just going to remove your apron. Okay. And aside from cleaning your dentures for you, did you need your face washed or anything like that?
No, I think it's okay.
Okay. And one thing I forgot to mention is if your patient was an independent feed, meaning they can do this by themselves, you want to make sure that you offer hand hygiene, okay? Especially if they can't get out of the bed. So what you would do is you would bring them the hand sanitizer, or you can bring washcloths in with soap and water to rinse their hands for them, okay? So I'm just going to remove your dentures, Miss Smith. Okay. So to remove dentures, what you want to do is you want to make sure you wash your hands. You want to wear gloves. And of course, if my patient were able to independently remove their dentures, then I would have them do it at this point. You need to be mindful that working with dentures, you want to keep in mind that they're very fragile and very easy to break, and they're very expensive, so we take good care of our patient's dentures just like we would our own teeth. When we are removing dentures, you want to take an index finger, you're going to go to the back of the patient's mouth at the top, and you're going to feel a little lip. And once you feel that little lip, you're going to pull down. You're going to do the same for the bottom teeth. You're going to put your finger in, go to the back, feel that lip, and you're going to push up. And then we can remove the dentures and bring them into the patient's denture cut. So Miss Smith, I'm just going to head to the sink to wash your dentures up for you. Is there anything else I can do for you?
No, I'm good, thank you.
Okay, doing all right. I'll be right back. So we have a sink here in Miss Smith's room. I have her dentures with me. And like I mentioned, they're very fragile. So what I'm going to do is I'm going to take a washcloth. And because the sink is a hard surface, I want to grab that washcloth and lay it in the base of the sink. From here, what I can do is I can take the patient's dentures and place them delicately on that washcloth. And that again is just decreasing the risk of having the dentures break. I brought a mouth swab with me to clean these. You might want to use the patient's toothbrush, or you might have other tools to use to clean the patient's teeth. But what I do is I always ask my patient how they do this at home, and I go with their preference, okay? Sometimes there is a special paste that you can use to clean these. Some patients will use normal toothpaste like a Colgate or a Crest, but keep in mind that toothpaste is very gritty and can actually damage the dentures. So that's why I like to check in with the patient to see what their preference is. So what I'm going to do is I'm going to turn the tap on. I'm going to soak my swab or my toothbed here, and I'm just going to scrub any food particles off of the patient's dentures. So I'm working with the palate of the denture first. Again, working very delicately. They can get a little bit slippery once they're wet, so you want to be careful not to hold them too high. Notice that I'm keeping it in the sink. And where the dentures connect with the patient's palate is typically where a lot of food particles get stuck. So I usually like to focus on those areas. And then once that's nice and clean, I'm going to give that a rinse. And then we're going to move to the teeth themselves on the dentures. So basically, you want to brush the dentures just like you would brush your own teeth, keeping in mind again that these are more delicate than your own teeth because they're not real. Getting rid of any food particles that are there. I'm going to set that top piece down, and I'm going to move to the bottoms and do the same thing. Okay, so get the area that connects with the patient's palate, and then get the teeth. Give those a rinse. And then what I can do is I can return the dentures into the denture cup. I'm going to put a little bit of water in there to soak them. Place that back in. Close that up tight, and then I'm going to return to the patient's bedside. So Miss Smith, your dentures are nice and clean. Did you want them back in for the afternoon?
Yes, please.
Sure, we can do that. I'm just going to swap my gloves out. Now, it's important to ask your patient if they want their dentures back in. Some patients like to leave them in for the day or take them out in between meals. So I'm going to return the dentures to Miss Smith. But let's say she wanted them out until supper time, or maybe we were getting her ready for bed. You really, again, need to assess what your patient's preference is. A lot of patients tend to keep their dentures in a med cup with a little bit of water overnight, and there's so many different pieces of equipment out there to help keep our dentures nice and clean. So we might put a small fizzy tab in there to keep the dentures nice and fresh overnight before returning them to the patient in the morning. Again, be mindful of what the patient uses in terms of cleaning supplies. Avoid really harsh, gritty toothpaste. I've had many patients where We'll leave the denture soaking in water with a few drops of mouthwash as well to keep it fresh. So it really depends on your patient preference and what's included in their plan of care. Okay. So again, for the afternoon, Ms. Smith, I have your tea there in front of you. I have your cranberry juice. I have a few other patients to go and see, but before I leave, is there anything else I can get for you?
No, I'm fine.
You're
Thank
fine.
you.
Okay. Again, your call bell's on your right-hand side. Your bed's in the lowest position. I don't see any obstacles in the way. You know if you need me to ring that call bell and we'll be in to see you, okay?
Okay, thank you.
All right. We'll see you in a little bit. Thank you.